Hi, I'm Dr. Darren Peterson of the Panhandle Heartburn Center, and I'm here to talk to you a little bit about your LINX procedure. So if you're watching this video, then you have undoubtedly had extensive conversations about your heartburn. And I'm going to potentially reiterate some things that you've already heard, but I want you to understand again the process that's occurring and what you're experiencing. So heartburn is basically a dysfunction of the valve at the bottom part of the esophagus, the LES, or the lower esophageal sphincter. And that muscle is incompetent. It just doesn't close the way that it's supposed to. So after having this procedure, what's been done has typically been two things. One, we've repaired your hiatal hernia, and two, we've added the LINX device, which has helped reestablish the normal resting tone of that lower esophageal sphincter. So what's happening now? Well, the additional resting tone is preventing the fluids from inside your stomach from refluxing back into the esophagus and giving you all the heartburn symptoms. Typically, by this time, you've noticed a dramatic improvement in the degree of your heartburn type symptoms. But you may be developing something called dysphagia. Dysphagia is described by patients in a number of different ways, but basically has to do with the sensations that you get when the esophagus is struggling to get food from the top part of the esophagus down through and into your stomach. It can be described as a pain or pressure sensation deep in your chest. It can be described as regurgitation, sometimes even vomiting of food and fluids. So what's happening? Well, several things. Your esophagus is not just a simple passive tube that food slides from one end to the other. It's a muscle. It's a very special muscle that propels food down from one end to the other in a series of concerted muscular contractions. Sometimes those contractions have been disturbed or decreased in their function because of the chronic reflux and the chronic irritation that your esophagus has suffered over the years of having your disease process. And it takes a while for the esophagus to recover. It's something that we measured preoperatively with that wonderful manometry study that you had done. As your esophagus is accommodating, it's experiencing sometimes spasms, so you'll have intense chest pain that can develop, or just difficulty in passing fluid. Thankfully, these spasms are very rare and only occur in a small number of patients. But if you're experiencing them, they can often be misconstrued as heart problems or cardiac problems. Rest assured, they're not. They're just spasms like a Charlie horse of your esophagus and will generally go away. If it happens more than once, you definitely need to call our office and let us know, and we'll walk you through that process. Any implantable device, be it a knee joint, a hip joint, a pacemaker, or a LINX device, is encapsulated. And basically what that means is the body is scarring that in, isolating it, or walling it off from the surrounding tissues. And we actually want that to happen. We've recognized that this scarring process induces a welding, if you will, of those tissues together that helps prevent hernias from coming back. It's one of the benefits that we didn't recognize when we first started putting these in. But as that process occurs, the scarring process becomes more and more robust and thicker, and it can make it more and more difficult for that band to open and close. And again, you can sense that. And so one of the things that I always inform you about is the need for you to rehab your esophagus. How do you rehab your esophagus? Well, it has to do with the way that you eat. I basically need you to increase the frequency of what you eat. It's not a volume thing, it's a frequency thing. I need something solid going past this device every 2 to 3 hours to force it to expand and contract while this encapsulation or this scarring process is occurring. That will allow the scar to become more pliable over time, rather than become stiffer and more difficult to move. If you're having problems during this process, certainly call our office and let us know. There's several protocols that we have set up in place to get you through this process. But you need to understand that this process can last up to 6 months. Most of the time it's shorter than that, but it can be up to that time period. And generally after that, those symptoms have resolved and you're back to a normal eating pattern. It will always change, however, the way that you eat. You'll probably always need to slow down, take smaller bites, and chew your food very well before swallowing. You may need to drink. Some patients find that drinking sips of water when they're having trouble food going down helps initiate those secondary contractions of the esophagus that push the food down in the stomach. Some patients find that that doesn't work very well. Everybody's a little bit different, and you just have to find the patterns that seem to work best for you.